Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you again about plantar fasciitis. So plantar fasciitis is one of the most common foot complaints. People come in with significant heel pain. They have problems getting up first thing in the morning, and their foot hurts like crazy. They can't walk. And a lot of times it can be described as pain in the heel or even pain in the arch. And we've talked a significant amount about it, but you've got to the point where you say, okay, I've been treating it at home, I've been doing everything I'm supposed to, and it's not getting better, so I'm going to the doctor. And really, what we're going to come down to is I'm going to actually walk you through how your plantar fascia should be evaluated to confirm that it truly is plantar fasciitis. Now, there's some key pieces here, and I'll try to point them out to make sure that you understand it. So with plantar fasciitis, this is a ligament. This is not a bone. And so if someone tells you, well, you have a heel spur in your bone, that doesn't necessarily confirm plantar fasciitis. So let's take you through this process. So you go into the doctor and you're saying, okay, here's my symptoms, here's my complaints, and it's fitting in to say, okay, this is probably plantar fasciitis because it's pain first step in the morning or after sitting for a period of time. It gets worse as you go throughout the day, although you initially get a little bit of relief as you start moving. It doesn't seem to be going away. It hurts right in the heel and or the arch area. And supportive shoes sometimes will help. So those cases. So all these symptoms, as you're naming all these symptoms, a lot of times the doctor will say, well, I'm pretty sure it's plantar fasciitis. Some individuals, some doctors will actually just diagnose you with plantar fasciitis and start treating it. That is not recommended. And I will explain to you why as we go through the next step. So if you have the correct symptoms, you say, okay, this is probably plantar fasciitis, then there are two real tests that should be done. Number one, you should do x-rays. Again, I told you right at the beginning, x-rays do not diagnose plantar fasciitis because you cannot see the plantar fascia. You cannot see ligaments on x-ray. You cannot see tendons on x-ray. You just see bone. So as you're looking at this plantar fascia with x-ray, there are a couple things you're looking for. People will a lot of times point out spurs. Say, look, you have this heel spur. That means you have plantar fasciitis. Heel spurs in the bottom of the foot don't hurt. If you got a heel spur there, it's going parallel to the ground. That's not the cause of your pain. It's actually a symptom of the problem. And what it does is you're pulling that plantar fascia off. You're pulling. The body creates a spur to try to keep it attached, to keep it from tearing off. And the spur itself never has to be removed. They used to remove them, but they found that it's not necessary at this point. So that is not important necessarily if you see it. If you see it, it usually just means you've had plantar fasciitis for a long period of time or you've had it multiple times. What we're really looking for is if you have a stress fracture, if you have cysts or tumors or anything like that in the bone, that could be another reason, less common of course, but another reason why your heel would hurt. Why is this important? Because if you have a stress fracture, if you have a bone tumor or a cyst or something in that area, most of the treatments that are used for plantar fasciitis will make these problems worse. And so you want to be careful and make sure that's diagnosed. Say, okay, it is not a stress fracture. It is not any other types of fracture. It is not a bone cyst or a bone tumor or anything like that. In fact, the bone looks pretty normal, except it may have a spur, which again is irrelevant as far as treatment is concerned. So once they rule out that it's not some of these other things, then they'll say, okay, now we need to confirm that it's plantar fasciitis. And so you can do this in two ways. You can either do an ultrasound or you can do an MRI. Now, I do not recommend MRIs. It's kind of overkill, but it does diagnose it. A better thing that a lot of times can be done in the office is you can actually do an ultrasound. You can actually look at the plantar fascia and you can measure it. You can say, okay, how thick is that plantar fascia? Is it normal or is it thickened? If it's thickened, then really what it comes down to is you're saying, okay, you have a plantar fasciitis because the normal thickness of the plantar fascia is like this, then yours is swollen, which actually shows an inflammation. You can also at that time through this ultrasound determine if it's a plantar fascial rupture or tear, which is treated similarly, but actually the recovery is a little bit harder, a little bit longer. But the idea is you can confirm that it is plantar fasciitis. If they don't do an ultrasound and they're telling you have plantar fasciitis, it means they're incomplete. You may get better anyway, but I recommend you expect an x-ray and you expect an ultrasound to confirm that you have plantar fasciitis. The third thing that you want to do, you're going to actually do secondarily. You're going to do after a little bit of time. because you want to get to the point where you can walk normal, but you want to be evaluated for how you walk. You want to do a gait analysis, say, okay, what am I doing? Why did I get plantar fasciitis in the first place? And that's a very important part. So as we talk about some of the treatments that you'll do in the office, then actually we'll do it. We'll talk about it a little bit more when we go, why does this come back, which is in a couple days. But I will actually talk to you about why it is important to get evaluated and determine what's the cause so you can actually treat this so it doesn't come back. So if you have plantar fasciitis, there are several things you should expect. You should expect them to take a good history so they know exactly what's going on. You should expect them to take an x-ray so they can actually determine if you have any other cause of your heel pain so that they don't treat plantar fasciitis and make your problem worse. Or number three, they should do an ultrasound to confirm the plantar fasciitis, because then you can start moving forward on getting this problem gone. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 220, plantar fasciitis, and what you should expect from your doctor when you're getting diagnosed with this problem.